Welcome runner to video number 5 of the TMM playlist. This week I'm going to tell you about runner's knee. Pain in front of the knee, which is very common, and a lot of runners do get scared when this happens and they think that it's going to stop them from running. So there are some do's and don'ts. I'm going to tell you about exactly the causes and what you can do right now to make sure that your pain goes away and you can finish your marathon pain-free. If you have not checked out the previous videos, then please do check it out. I'm going to put a link here below. So check out those videos because I have told you last week about the most important thing as a runner that you should be doing about cramps and whether you are or you're not ready for your marathon. So check out those videos, and if you have any questions, don't hesitate to put it in the comment and ask me. Hi, I'm Dr. Rajni Patil. I'm a spine and sports physiotherapist practicing for over 23 years here at Ortho Sports Physiotherapy in Shivaji Park, Mumbai. What exactly is runner's knee? Runner's knee basically means that you have pain as a runner in front of the knee, on the patella. This is very different from knee pain elsewhere. Back of the knee, inner side of the knee, outer side of the knee. These are all very different things. These are not called runner's knee. Runner's knee typical symptoms are pain in the front of the knee, and you as a runner will have it either in the first few mileage of your running, or it will not be there when you first start running and it will keep increasing as you increase mileage. You may also, if the pain has kept getting worse and you've not really addressed it at the beginning, it might also then become a part of your life. Like जिस दिन आपने रन किया है उस दिन आपको शाम को उठने बैठने में पेन हो सकता है, स्टेयर क्लाइंबिंग में पेन होगा, नीचे जाते वक्त पेन होगा. Things like that also might start to happen. So it's best that you address that right away and not wait for the symptoms to get worse with time. What is the other knee pain that happens to runners? It is pain on the outer side of the knee. This is known as ITB syndrome, and this is also very common in runners. Pain on the inner side of the knee can mean different things, on the back of the knee can mean different things. So if you have any knee pain that is anything on the VAS scale more than a 4 or 5 and it's consistently happening with your runs, then you should make sure that you treat it right away, either by seeing your ortho or by seeing a sports physio who understands running really well. If you're training for your marathon and you have knee pain, then check out this video that I made last year, which will give you specific things to do for your knee pain. Now, let's look at the solutions. If you have runner's knee, here are the 4 specific things that you need to do right away now. Look at it as a big picture so that your runner's knee that has happened now will not keep happening to you over the years as you keep training for your marathons. Solution number 1. Rest is not the answer. Active recovery is the answer. What do I mean by that? You want to do active recovery, so you may need to rest it out for some time. However, you will also need to foam roll. Use your foam roller that has been just sitting there most likely. Do a lot of stretching and start a little bit of strength work, and I'll tell you where to start training for strength. But don't forget to do ice packs. Ice pack should be your friend when you're doing active recovery for your knee pain. Solution number 2, improve your hip control. Your hip control basically means the strength of your gluteus maximus and your gluteus medius. Check out my last week's video where I have told you the step-by-step way to correctly improve strength for glute max and glute med, because most people are jumping into the advanced compound exercises and hence not activating their glutes during the run. So check that video. I'm putting it in the link below. Definitely look at it after you finish watching this video. Once you have strengthened your glute max and glute med, you will also need to strengthen your VMO, your vastus medius obliques muscle. This is a part of your quadricep muscle. This muscle often, in my experience after treating thousands of runners, I have seen that this muscle, if it's weak, maximum load falls on the middle and the lateral quad, and hence people are getting runner's knee as well as ITB syndrome. So you will need to work on your VMO, but again, this is done incorrectly. People do this wrong. Please figure out the right way to do it. I'm again giving you a video that I have done on this 4 basic exercises, but make the biggest difference. So check it out, putting the link below. Do those exercises and you will see the difference. Now, only strengthening is not going to help. You will also need to improve your running form. Now, because you're so close to your marathon, I would not jump into making big changes in your running form. You will need to look at the one big mistake you are making in your running form and try to correct that. The most important one I would try to fix is whether you are activating your glutes during the run or not. It's not very easy to do. It's going to take a little bit of effort. But there, if you can figure out if you're using your glutes well and you're running with your core engaged, then that's a better way to run. That's going to take the load off your knee and hence the knee pain will gradually reduce. I have a set of exercises for the knee for runners that I will link it here and here. Check that out. If you have active knee pain, which means your VAS scale is more than a 4, 5, 6, then you don't want to do these exercises right away. But if your knee pain is just starting VAS scale 0 to 4, then you can do these and it will make your knee pain go away. Solution number 3 is to release all the tight muscles on your quadricep. Like I told you a minute ago, running is a repetitive sport, so if you're over and over using your quadricep muscle primarily, then this is going to cause runner's knee. What will you do for that? Start foam rolling. Start foam rolling your quadricep muscles, so the middle quad and the ITB, the lateral quad as well. If you don't know how to correctly foam roll, please check out the playlist that I'm giving you here. I'm linking it below. Most runners do foam rolling incorrectly. So look at the video, figure out how exactly to do it and follow the video to the T. Because in that video, I've given you how to foam roll the quad, how to release the trigger points if you have them, and how to stretch the quad effectively. That's going to make the difference. So do it in that sequence and see how it works for you. Solution number 4. Remember I told you you have to look at your hip as well as your foot to treat your knee to make the knee pain go away. So here you're going to start looking at your foot. What do you want to know? Whether you're an overpronator, supinator or a neutral foot. You as a layperson or as a runner may not understand this, so you can take the help of your sports physio. If you need my help for it, certainly come down to the clinic. We can do this online as well. A running assessment is the first place to start, which will give you an idea of what your foot type is and what kind of shoes are right for you. Correcting this little thing as well as working on foot strength, that will make a big difference in your knee pain. I think this video was helpful to you. Please do share it in your running groups and with your running buddies, because a lot of people do have runner's knee and they don't know how to address it and they panic unnecessarily. There are solutions to fix it. 100% the pain can go away. So do share the video with them. Also, if you have not picked up my runner's guide, then I will link it below. Pick it up. It's absolutely free. It has a lot of exercises for foam rolling, stretching, warm up, cool down. A lot of running tips are in there. So definitely do pick it up. Don't forget to like this video, comment, let me know if you have runner's knee and if there is something specific that has worked for you. I would love to know. Don't forget to subscribe to the channel, because every week up to Mumbai Marathon, there is a video coming your way which will give you tips on how to ace your marathon without pain.